Go ahead.
Good afternoon, all. Welcome to another live from Oasis Fertility. I'm Dr. Devi. I'm the Clinical Head and Fertility Specialist at Oasis Fertility, Banshankari branch, Bangalore. Today, we are going to discuss something about the most common questions which patients have during IVF cycles. So, going into an IVF cycle can be a different kind of an experience for many people. So, they come in with lots of expectations, questions, worries, anxieties. So, it is natural that you will have lots of questions also in your mind. So, the purpose of this session is to um, it's a try towards clearing some of those doubts and questions in some of your minds. So I hope this session will be helpful for all. So the first question which I would like to answer is the most common question which is asked: why do I need an IVF cycle? So you would have visited a fertility specialist, that they would have assessed you, analyzed what are the issues with you, and then they would suggest an IVF cycle only if and only if it is really needed. The most common reasons why you would need an IVF cycle is maybe your fallopian tubes are not normal. Maybe you would have tried long, simple cycles like ovulation inductions, multiple cycles of intrauterine inseminations of sperms. Maybe you have very less number of eggs. Maybe the egg number is very good. Maybe there is some hormonal abnormality like a PCOD, but you would have probably tried multiple other things and things have not worked out. Sometimes there is something called an unexplained infertility where everything is seemingly normal, but still pregnancy is not happening. In scenarios where the sperm is not really normal, there is very less number or very less moving sperms or very less good looking sperms, or something like the DNA integrity of that sperm is not really good, poor quality sperms. These are the most common reasons why you might require an IVF, or even if multiple other things like IUIs or ovulation inductions or simple treatments have failed, or previously an IVF itself has failed. There are certain specific scenarios where you might require an IVF where we would want to genetically test you or the embryo or the baby, like recurrent pregnancy losses. You have lost multiple pregnancies, or multiple times IVFs have been done and the babies are not really getting stuck or implanted. These are the very common scenarios why you would really need an IVF cycle. The second most question which is asked is you would be going through an IUI cycle, or multiple 2 or 3 or 4 IUI, intrauterine insemination cycles, would have already been done. Can I try, doctor, one more IUI cycle? Is a very, very common question asked. Again, see, we would be advising you an IVF or an IUI. In that, we would be requesting you to go ahead with an IVF cycle only if it is really needed. So IUI is a treatment which has a success rates of approximately 10 to 15% per cycle. And if you see the success rate of an IUI cycle itself, it slightly becomes more over the first 3 or 4 cycles. If it is this much per the first cycles, this much in the second cycle, this much in the third, fourth, and then it plateaus or kind of drops. So if you waste too much time doing too many IUI cycles, it may not be really fruitful. And I always tell the patients, if you feel psychologically ready to go ahead with an IVF cycle or not. If medically, according to the medical recommendation, if it is an IVF cycle which you need, and if you still waste too much time doing an IUI cycle, then your success rate in that IVF cycle itself comes down just because we delayed the treatment. So only if it is really needed, we would be recommending you to go ahead with an IVF cycle. And when it is done, it is better to go ahead with an IVF cycle without much delay to get the optimum outcome in that IVF cycle also. So yes, if it is recommended, doing one more IUI cycle may not do any harm, but it may really reduce your chances of IVF itself simply because of the delay. And even in particular scenarios where the woman's egg number is very low, etc., by wasting more time in an IUI cycle, you are really doing more harm than good. The third most common question asked is, doctor, what should I be expecting during an IVF cycle? How many scans are there? How many blood tests are there? How many visits will be needed? So I would like to take you in detail through this. So any IVF cycle, it just doesn't start on the second or third day of your periods. You have to visit your fertility specialist. We have to see you, analyze and see why the IVF is needed. Also, we have to prepare you prior to the IVF to understand if any pre-preparations are needed for you in terms of investigations, blood tests, scans, weight reduction, medicines to improve the quality of the eggs and sperms, medicines to sometimes even start the IVF cycle. So once all that is done, you visit us after the preparation on the second or third day of your periods most of the times. And a scan and a blood test is done. And if the scan and the blood test is normal, we start injections for you. You will have to take daily injections at the same time, and the cold chain of these injections have to be maintained. So these injections will go on for approximately 10-11 days. For some people, it is just 8 days, and for some people, it might go even up to 13, 14, 15 days. But on an average, very commonly 10 to 11 days of daily injections at the same time. Again, these are very tiny needles, very painless injections. Some people even take these injections on their own also regularly. And in these 10-11 days, I would call it a vigorous period where you have to come up and down for scans and some blood tests. So initially in the first 3-4 days, after the first 3-4 days of injections, we might scan you. And once in every alternate days to once in 2 days, you might have a scan plus or minus a blood test. So overall 4 to 5 scans and 3 to 4 blood tests in this period of 10 to 11 days is what you can expect. At the end of that period, your eggs will be grown in both your ovaries, whatever is there will be grown. So once it is there, we give you an injection in the night, which is called a trigger injection, which is for the final maturity of these eggs. We leave a gap of a day, and the next day is something called an egg pickup, which happens. What is that? We put a needle, tiny needle through the vagina under IV sedation for you. You will be sedated for this, otherwise you may feel pain. So when we do like this, you will not feel any pain. So by putting a tiny needle through the vagina under ultrasound guidance, we take these eggs out of your body, of the woman's body. This is called egg pickup. The same day, sperms are also taken. Every egg is injected with a sperm after doing a sperm selection by different methods. That's called ICSI. Or you can even allow something called an IVF, where the eggs and sperms are kept together and allowed to fertilize on their own. Now, once this is done, the embryos start growing in the lab. The embryos grow in the lab for a period of 5 to 6 days, at the end of which the embryos are formed. We see them, grade them to understand what is the quality of them. And if you are a suitable candidate for a fresh embryo transfer, the embryos are put back into your womb through a fine, thin catheter, a tube, under ultrasound guidance. This is not painful at all, so you don't require any sedation for this. Now, some people are not suitable for this. So for them, something called a frozen embryo transfer is needed. What is that? Now, once embryos are formed on day 5 or 6, we freeze them. You will get a bleeding in a period in another 5-6 days time. You take a gap, a break of a month. Why that gap is needed? For some people, the hormone levels will be quite high when we take the eggs out, or the uterus may not be ready, or the ovaries may be too big. In such scenarios, if you put the embryos back in it, they may not stick, and you may end up in having a complication also, which is called hyperstimulation. To avoid all these, we might suggest a frozen embryo transfer to you. In that, the formed embryo on 5th or 6th day after the egg pickup is being done is frozen. We give you a gap of a month after your bleeding. So after 1 month's gap, you get another bleeding. So by that time, your ovary size would have come down, the hormones would have come down to baseline. You get a fresh bleeding. Second or third day of that bleeding, we have to scan you. There might be some blood tests also. We give you tablets or gels which can be applied on the skin, or vaginal tablets, etc., to build up the lining of your womb artificially. And how the lining is grown is monitored by serial scans. Again, after 8-9 days and once in 3-4 days, some 3-4 scans can be there over a period of 15 to 20 days from the time you get your bleeding. Once the lining is ready, we put the embryo. We melt these frozen embryos back and put them back in This is called a frozen embryo transfer. So once the embryo is being transferred, 2 weeks later, you get to know about whether it's a positive or a negative result. During these 2 periods, you will be given lots of medicines in terms of pregnancy support if it happens. So this is how an IVF cycle happens. So this takes me to the next question, which people ask, the fourth question, which is, doctor, can I work during the IVF cycle? Do I really need a bed rest? Do I have to take off? That's not really needed, because you can schedule, as you just saw how an IVF cycle works out. You can schedule your injections, you can schedule your blood tests, scans, visits to the doctor according to your comfort level. So you can continue working through the entire IVF cycle. And if you happen to stay slightly far from the IVF center, you still have an option of taking your injections on your own, provided you take care of the cold chain maintenance of the injections. And we can teach you the techniques also, how to take an injection, etc. Now, after the embryo transfer also, we do not really recommend a bed rest to the patient. You might require help at home in terms of cooking, cleaning, etc. We really don't want you to physically or emotionally, psychologically strain yourself. That's all. Be at your best possible self, physically as well as emotionally, during that period when the embryo has been transferred to you. That's all. So you really don't have to take off from work at all. So that comes to the fifth. Let's see the fifth question, which I would like to take, which is, do these medicines have side effects? Doctor, do I get a cancer because I took IVF injections? It's a very common question asked. Now, there is no medicine in this world without a side effect. So we just have to think about minor side effects or major side effects. Yes, all medicines will have minor side effects. Like, for example, in IVF medicines also, you may feel bloated, you may feel thirsty. Some people feel very tired while they're taking these IVF injections. Some people may not feel anything at all. And these are very tiny needles. Pain is very, very, very minimal or negligible during these injections. And do I get a cancer because of these injections? No, there is no evidence to prove that IVF injections will lead to cancer at all. There was some evidence which came up which said borderline, not cancerous, borderline ovarian cyst, slightly more in this population, and still nothing to worry about that at all. So no, IVF will not make you get breast cancer or ovary cancer or uterus cancer or cancer of any other place. And even after the egg pickup is being done, you might feel slightly bloated and heavy down below. And this is not fat, trust me. This is just water retention in the body, which is also likely to go away if you just give it a period of a week to 10 days time. If you continue your workout and your healthy diet, you will not gain weight also due to the IVF procedure. So to the sixth question, which is usually asked, is, will the baby born out of IVF be normal? Will the baby be abnormal? So the chance of you getting a baby, the chance of you getting a normal or an abnormal baby through a natural intercourse or an IVF remains very comparable. So it's very comparable because it's your own eggs and your own sperms which is being used and made into an embryo and transferred into your womb. Just because you did an IVF, it doesn't increase the chances of having an abnormal baby at all. 2 to 3% is the chance of having an abnormal baby, even in a natural population where no IVF is being done. The same translates, the same is what is there in an IVF population also. The next question is the success rate of an IVF cycle. I would like to say that the success rate of an IVF cycle cannot be generalized. It depends on you. It depends on your egg number quality, your sperm quality, hence the embryo's quality, which is formed from your own eggs and sperms, and your womb and all other general factors which is there. So in a very good prognosis case where egg number is good, sperm is good, quality is very good, it will go up to 50%. And it might go higher also in some scenarios. But if the egg number is extremely low with a poor quality egg, no sperm there, etc., it might go down to 25% also. So yes, it cannot be generalized, but on an average, 50% is the success rate of an IVF cycle. It may vary from patient to patient. There are months in which it would have gone much higher. There are months in which it would have gone much lower, depending on the patient profile. But yes, it cannot be 100% for all. On an average, it is 50%, and 50% is a very, very good success rate, because when you do simple cycles where you take medicines and try, the success rate is around 5 to 7%. And an IUI has a success rate of 10-15%, and a very good prognosis case is 20%. So if you compare that to this, an IVF has much, much better success rates, and it has the best success rates among all the fertility treatments which are available. So the next question is the cost of the IVF cycle. Often people ask, do we have any hidden costs involved? Are there additional charges, additional medicines, etc.? So in a place like Bangalore, an IVF cycle in any good hospital might range somewhere between 1.5 to 2.5 lakhs for one cycle. Again, it depends a lot on why this IVF is being done, what is your egg number, and your height, weight, and other factors, why we had to do this IVF in the first place. It depends a lot on that. And if you ask about the hidden charges, usually there are no hidden charges in any good standard place. But if you have embryos, excess embryos to freeze, freezing charges may come. And if your body requires additional support with medicines, which is in addition to what is being normally used, yes, additional cost of medicines also might come in an IVF cycle. So, so the second last question, which is the ninth question, which I would like to answer is, what happens after a failed IVF cycle? Now, as I told, IVF success rate is 50%. That means for some people, IVF can fail. Now, what next? It's very unfortunate when an IVF cycle fails. It's quite depressing. It is very sad. So it's very important that you sit with your fertility specialist and have a very open discussion as to why it happened. So we can really list out and see what are the possible reasons why it would have happened, and where we can tackle it and what can be done next. So sometimes we tell you additional investigations in terms of blood tests. Sometimes we put a small camera into the womb and see if there is anything abnormal. We might put you on additional medicines to modulate your body's conditions. We might even consider a laparoscopic surgery to improve certain factors inside the tummy. And we might even suggest something where, if we are really suspecting the baby to be abnormal and all, we might even suggest genetic testing of the baby, the embryo, or genetic testing of your lining to see if the timing of that embryo being put inside was right or not. So these are the very common scenarios in which an embryo transfer on an IVF can fail. And if that happens, this includes an analysis in this line, finding out the cause and striking it at that, so that it becomes a success next time. That takes me to the last question, where how many IVF cycles can be done? That's my 10th question, which I would want to answer. There is no particular guideline to say only this many cycles of IVF can only be done for one particular patient. On an average, within the first 2 or maximum 3 IVF cycles, most of the patients do get a successful pregnancy. And there are scenarios in which and that is the most common scenario, in which the very first IVF cycle itself might result in a pregnancy. But there are some scenarios in which multiple cycles, natural cycles, 7, 8 cycles also have not resulted in a pregnancy as well. It purely depends on your scenario. What is your egg number quality against sperm number quality? So in scenarios where excellent quality eggs and sperms and uterus is there, one cycle may be sufficient. But whereas people who do not have eggs at all or sperms at all, they may require up to 3 cycles sometimes to get one embryo. So it may range anywhere from 1 cycle to 7, 8 cycles. There is no limit as to how many number of IVF cycles you can do. But on an average, in poor cases where egg number is very low, etc., 3 cycles may really be needed to get 1 or 2 sets of good embryos. So these are the very most common 10 questions which our patients ask us during the IVF treatment while they are preparing or going through the IVF treatment. I hope this session is useful to anybody who is trying to prepare to go through an IVF cycle. Thank you for your patient listening. Thank you. I would like to take any questions if it is there. What is the most critical part of IVF? So the most critical part of IVF is creating embryos. Getting your eggs and sperms out in the most delicate way possible with the best possible medicines and monitoring, and making a very good quality embryo. And the second, but not the least, is preparing your lining and putting that embryo back in the softest way possible in the best possible lining. Are there any other questions? Yes. What is the hardest thing about IVF? The hardest thing about IVF, I would say, is waiting time. So, see, if you really, really want something and you have some time to wait for it to get it, wouldn't it be hard for anybody, any human being? Yes. So, the hardest thing in IVF would be waiting time until that embryos come to you and they turn into a positive pregnancy and the baby. Until the baby is delivered, trust me, it is hard, the waiting time. Any other questions? How can I make my first IVF successful? So as I said, it is extremely important to have a good relationship with your, it's important to find a good team initially. So who will see what is the actual reason why the pregnancy is not happening, and plan things according to what is needed for your body, and plan a very good IVF cycle. So once the embryos are made and they are of a good quality, preparing your lining in the most delicate way possible, and a smooth transfer where it is put back into the womb without difficulty is of utmost importance. From your side, what you could do to make your IVF successful is to follow the instructions of your doctor carefully. Have a very, very open discussion with your doctor as to what is happening at each and every point of time. Medicines to be taken very properly, psychologically and physically. Be at your best possible self while you're going through these treatment cycles. And if you really need help in terms of counseling, all the help is out there. There are very good counselors also who can help you with keeping yourself calm and positive throughout this treatment cycle. Any other questions? How do I prepare my body for IVF? Yes, so as I mentioned earlier, during any IVF cycle, a pre-treatment is included where we see you, try to analyze and see if there is anything abnormal which needs a correction, put you on medicines to optimize your body conditions and reducing weight, etc. And once all that is done, only we'll be starting your IVF cycle. So this kind of a preparation in terms of following a very good diet, exercise, taking medicines properly, and keeping yourself stress-free is of utmost importance. Any question? What not to eat after embryo transfer? Every single patient will ask this question, what not to eat after embryo transfer? You can pretty much eat anything. The key is to eat healthy food in the right amount. That's all. There are particular things which we might tell you to avoid. There is no evidence for this at all, but still we might tell you to avoid things which may increase the uterine contractions, the womb's contractions, like raw papaya, which might contain papain, and pineapple, which might contain bromelain, and sesame seeds, etc. Apart from that, we would want you to eat a healthy, balanced, nutritious diet which is suitable for your body. That's all. Any other questions? So if there are no other, if any other questions are there, you can comment in the comments box below. We would be really happy to take up those questions and answer them for you. So thanks once again for your patient listening. Thank you and bye.